The letter arrived on a Tuesday morning, written in careful handwriting on hospital stationery. Ellen's production team received hundreds of letters every week, but something about this one made the intern who opened it pause and read it twice before passing it up the chain. "Dear Ellen," it began, "I'm writing about someone who saved my family when we had nowhere else to turn. When my daughter was fighting for her life and the medical bills were burying us alive, a stranger walked into the hospital billing office and paid our entire debt. We tried to thank her, but she just said, 'Pass it forward when you can.' I think you should meet Linda Chen." What Ellen didn't know was that she was about to encounter a woman who had turned her own devastating loss into a mission of mercy, quietly revolutionizing how one community deals with medical bankruptcy, one family at a time. Linda Chen sat in the green room, her hands folded in her lap, still amazed that she was about to appear on national television. At 52, she had the quiet demeanor of someone who preferred working behind the scenes, the kind of person who changed lives without seeking recognition or praise. She thought about the call that had brought her here. A producer who had somehow tracked down her story through a network of grateful families, hospital social workers and billing department employees who had watched her perform what could only be described as miracles. For 3 years, Linda had been haunting hospital billing offices across Los Angeles County, armed with nothing but a checkbook and an understanding of financial devastation that came from living through it herself. She had become a legend among hospital staff, the woman who appeared without fanfare, quietly settled catastrophic medical debts, and disappeared before families even knew what had happened. The story began 4 years earlier, in the oncology wing of Cedars-Sinai Medical Center, where Linda's husband David had fought a 2-year battle with pancreatic cancer. The disease had been aggressive, requiring experimental treatments, multiple surgeries, and round-the-clock care that insurance covered only partially. Linda had watched their savings disappear, then their retirement fund, then their home equity. She had sold her jewelry, her car, even David's art collection, pieces he had spent decades acquiring, and that represented his passion for creativity and beauty. By the time David died, Linda was not just grieving the loss of her soulmate, she was drowning in $340,000 of medical debt. The months that followed were a blur of bill collectors, bankruptcy lawyers, and nights spent sitting at her kitchen table, staring at statements that might as well have been written in a foreign language. Linda had always been financially responsible, but nothing had prepared her for the crushing reality of serious illness in America. It took her 18 months to climb out of bankruptcy, 18 months of working 2 jobs, living on ramen noodles, and learning to navigate a system that seemed designed to punish people for getting sick. But somewhere in that struggle, Linda had made a promise to David's memory: if she ever got back on her feet, she would make sure no other family went through what they had endured. The idea started small. Linda began volunteering in hospital billing offices, helping confused families understand their statements, negotiate payment plans, and access financial assistance programs. But as she saw more and more families facing impossible choices, medication or rent, surgery or keeping their homes, Linda realized that understanding the system wasn't enough. Sometimes what people needed was a miracle. Her first anonymous payment was for $3,020, the outstanding balance for a young mother's emergency appendectomy. Linda had watched the woman cry in the billing office, explaining that she was a single mother of 3, working 2 minimum-wage jobs, and had no idea how she would ever pay the debt. Linda waited until the woman left, then quietly approached the billing clerk. "I'd like to pay that balance," Linda had said simply, "but please don't tell her who paid it. Just tell her it's been taken care of." The relief on the billing clerk's face told Linda everything she needed to know about how often these situations arose. "Are you sure?" the clerk had asked. "This is very generous." "I'm sure," Linda replied, "and if you have other families in similar situations, please let me know." That was the beginning of what hospital staff would eventually call Linda's miracles. Anonymous payments that appeared seemingly from nowhere, settling debts that families had no hope of paying. Linda developed a system, working with hospital social workers and billing departments to identify the most desperate cases, families facing medical bankruptcy, or choosing between treatment and basic necessities. As Ellen introduced her to the audience, Linda walked onto the stage with the same quiet dignity she brought to hospital corridors, the unassuming presence of someone who had learned that the most powerful acts of kindness are often the quietest ones. "Linda," Ellen said, once they were both seated, "I have to start by asking you something that might seem obvious, but I think our audience needs to understand. You pay strangers' medical bills, completely anonymously. Why?" Linda paused, choosing her words carefully. "Ellen, 4 years ago, my husband David died of pancreatic cancer. The disease didn't just take his life, it took everything we had built together. Our savings, our home, our future. By the time he died, I was not just grieving, I was financially destroyed. The studio was completely quiet. Ellen could see audience members leaning forward, drawn into Linda's story by the matter-of-fact way she described such profound loss. I spent almost 2 years climbing out of medical bankruptcy, Linda continued. 2 years of working multiple jobs, living on almost nothing, learning how a medical emergency can destroy a family's entire financial foundation in a matter of months. Ellen felt tears pricking her eyes. That must have been incredibly difficult. It was, Linda nodded, but somewhere in that struggle, I realized that what David and I went through was not unique. Every day, families are facing the same impossible choice: get the medical care you need, or keep your financial stability. In the richest country in the world, people are choosing between medicine and rent. Linda's voice grew stronger as she continued. So I made a promise to David's memory. If I ever got back on my feet financially, I would make sure other families didn't have to choose between healing and surviving. Ellen was struck by the quiet power in Linda's words. And how do you decide which families to help? I work with hospital social workers and billing departments, Linda explained. They see families every day who are facing medical bankruptcy, people who need surgery but can't afford it, parents choosing between their child's medication and keeping the lights on. I ask them to identify the most desperate cases. Ellen leaned forward. Linda, can I ask how many families you've helped? Linda thought for a moment. This year alone, I've paid medical bills for 23 families. Over the past 3 years, probably around 80 families total. The number hit the audience like a physical force. 80 families, 80 groups of people whose lives had been changed by one woman's decision to transform her own tragedy into someone else's salvation. 80 families, Ellen repeated, her voice barely above a whisper. Linda, that's not just generosity. That's a movement. That's proof that one person really can change the world. Ellen stood up and addressed the camera directly. Ladies and gentlemen, what Linda is doing challenges everything we accept about healthcare in this country. She's proving that medical bills don't have to destroy families, that there are people willing to step in when the system fails. Ellen turned back to Linda. I have to ask, and I hope this isn't too personal, but how do you afford to do this? These must be enormous amounts of money. Linda smiled sadly. After David died, I received a life insurance payout. It was money that was supposed to fund our retirement together, our golden years. Instead of using it for myself, I decided to use it to help families stay together during their darkest moments. She paused, looking out at the audience. David always said that money was just a tool. What mattered was how you used it to make the world better. I think he would approve of how I'm using our nest egg. Ellen reached for tissues, openly crying now. Linda, I have something to tell you. We reached out to some of the families you've helped, and several of them wanted to be here today. Linda's eyes went wide with surprise and concern. But I asked the hospitals not to reveal my identity. Don't worry, Ellen reassured her. We didn't break your anonymity. These families reached out to us after hearing you were going to be on the show. They put the pieces together themselves. That's when Ellen gestured to her production team, and from backstage came a small group of people, parents, children, elderly patients, all walking onto the stage with expressions of overwhelming gratitude. Linda gasped, recognizing several faces from her memory of hospital corridors and waiting rooms, even though she had never formally met any of them. The first to step forward was Maria Santos, a young mother holding the hand of a 7-year-old boy who looked healthy and vibrant. You saved my son's life, Maria said simply. Miguel needed heart surgery, but we couldn't afford it. I was working 3 jobs and still couldn't come close to paying for the operation. Then one day the hospital called and said our bill had been paid in full by an anonymous donor. Maria's voice broke slightly. The doctor was able to schedule Miguel's surgery immediately. If we had waited longer trying to figure out how to pay for it. She didn't finish the sentence, but everyone understood. Linda was crying now, seeing the healthy child standing before her, understanding that her decision to pay a stranger's medical bill had literally saved a life. But there were more families. An elderly man named Robert stepped forward, leaning on a walker but moving with determination. My diabetes medication costs $800 a month, he said. On Social Security, I was choosing between my medicine and my rent. I ended up in the hospital with diabetic ketoacidosis because I was rationing my insulin. Someone paid my emergency room bill, $18,000. The social worker told me it was an anonymous donation. Robert looked directly at Linda. You didn't just pay my bill. You saved my life and taught me that there are still angels in this world. Ellen watched this unfold with tears streaming down her face, understanding that she was witnessing something that transcended television, transcended entertainment. This was pure human compassion in action. Linda, Ellen said, these families represent just a fraction of the people you've helped. But I want you to see the impact of what you're doing. You're not just paying bills, you're saving lives, keeping families together, restoring people's faith in humanity. Linda wiped her eyes, overwhelmed by seeing the faces of the people she had helped, understanding for the first time the full scope of what her mission had accomplished. Ellen stood up and addressed the camera once more. This woman has spent 3 years proving that healthcare doesn't have to bankrupt families, that there are solutions to medical debt beyond suffering and silence. Ellen turned back to Linda. I have something for you. The Ellen DeGeneres Foundation wants to amplify what you're doing. We're establishing the Linda Chen Medical Relief Fund, with an initial donation of $1 million, specifically to help families facing medical bankruptcy. Linda stared at Ellen in complete shock. $1 million? $1 million, Ellen confirmed. Because what you've shown us is that medical debt is a solvable problem. It just requires people who care enough to solve it. But Ellen had one more surprise. From the group of families, Miguel's mother Maria stepped forward with an envelope. Linda, Maria said, all of the families you've helped got together. We wanted to give you something, but we knew you wouldn't want our money. So instead, we started a fund in David's name to help other families facing cancer-related medical debt. She handed Linda the envelope. It's not much compared to what you've given us, but we wanted you to know that David's legacy is living on through every family you save. Linda opened the envelope with shaking hands. Inside was a check for $25,000 and a letter signed by dozens of families, thanking her for showing them that kindness still existed in the world. Ellen watched this exchange with a sense of awe. Ladies and gentlemen, this is what happens when someone transforms their own pain into purpose. Linda didn't just survive her tragedy, she used it to prevent other families from experiencing the same suffering. As the show continued, Ellen made an announcement that would change the trajectory of her platform. Starting next month, we're launching a series called Medical Angels, highlighting people like Linda who are finding innovative ways to address healthcare costs in America. Because what we've learned today is that medical debt doesn't have to be a life sentence. After the cameras stopped rolling, Linda remained on stage, surrounded by the families she had helped, finally meeting the people whose lives she had quietly transformed. For the first time in 3 years, she was seeing the human faces behind the billing statements, understanding that her anonymous donations had ripple effects she never could have imagined. Ellen joined the group, no longer the host but simply another person moved by the power of what she had witnessed. Linda, Ellen said quietly, how do you decide which bills to pay? How do you choose between so many families in need? Linda thought for a moment, then answered with the wisdom that comes from understanding loss at its deepest level. I don't choose, Ellen. I just keep saying yes. Every time a social worker calls me about a family in crisis, every time I see someone facing the same impossible choice David and I faced, I remember what it felt like to be drowning in medical debt. And I think about how different our story might have been if someone had thrown us a lifeline. She gestured to the families around her. These people aren't statistics or charity cases. They're me and David 4 years ago. They're every family that gets sick in America and discovers that our healthcare system can destroy your life even while it's trying to save it. Today, Linda Chen continues her mission with the expanded resources provided by Ellen's Foundation. She's also become an advocate for healthcare reform, speaking at conferences and working with policymakers to address the root causes of medical bankruptcy. The Linda Chen Medical Relief Fund has helped over 300 families in its first year, but more importantly, it has inspired copycat programs across the country. Linda's model, working directly with hospitals to identify families in crisis, has been adopted by charitable organizations nationwide. Miguel Santos, the little boy whose heart surgery was made possible by Linda's intervention, is now 8 years old and thriving. His mother Maria has become a volunteer with the Medical Relief Fund, helping identify families in need and proving that kindness truly does multiply when it's shared. The lesson Linda taught millions of viewers that day was profound in its simplicity. Medical emergencies don't have to mean financial emergencies. Healthcare debt is not an inevitable consequence of getting sick. It's a choice our society makes, and it's a choice that can be changed by people who refuse to accept that suffering is inevitable. Because when someone transforms their own medical bankruptcy into a mission of mercy, they're not just paying bills, they're proving that the most expensive problems often have surprisingly simple solutions. Someone who cares enough to help, someone who understands that healing happens not just through medicine, but through the kindness of strangers who refuse to let others suffer alone. That's not just charity, that's revolution. That's what happens when someone decides that their own pain can become someone else's salvation, that their tragedy can become someone else's miracle. And sometimes when that decision is made 80 times over 3 years, it creates not just individual rescues, but a movement that proves the most powerful medicine of all might just be the knowledge that you're not facing your crisis alone.